Hi, I'm pleased today to be talking with Nancy Dreyer of IQVIA, and I'm joined by my colleague from Long COVID Support, Adina Gerver, and we're going to be learning a little bit more about what IQVIA does and why and how it's working in the field of COVID and specifically long COVID. So Nancy, I just wondered if you could perhaps kick off by introducing the organization that you work with and your role within that.
First of all, thank you so much for giving us this opportunity. What you're doing is extremely important to not just to each of the participants in the countries you represent, but the world. It's a very important effort. I work for IQVIA, which is a human data science company. Probably an unfamiliar name to you because it represented the merger of two big companies about 5 years ago. One that specialized in clinical trials and one that specialized in big data. But I'm an epidemiologist. I've been in the field for close to 40 years. I'm the chief scientific officer in one of the three pillars of IQVIA called Real World Solutions. And this, unfortunately, is my third go around with a pandemic. So I started with H5N1, learned a lot in Southeast Asia, and one of my lessons is it's a lot more fun as a researcher to study it than to live it.
Yeah. So what's the connection of IQVIA to COVID and specifically long COVID?
We created a registry called available on the web at www.helpstopcovid19.com. No hyphen, just helpstopcovid19.com for the purpose of studying COVID. Now, we started this a year ago in the US and then later launched in the UK and are trying to get this in other countries. But the purpose was to understand COVID with a focus outside the hospital, right? Because there was tons of research coming out on hospitalized patients, critically important. But what about the thousands, hundreds of thousands of people who never go to hospital, who are quite sick, often with persistent symptoms, but aren't the best way to study them is not through medical records. So we decided to build a community-based registry, reaching out to people, first, if you'd had COVID symptoms, whether or not you've ever been tested. Because as Adina knows, we live in the same country, tests were hard to get a year ago. And sometimes they're still hard to get or expensive to get. So it doesn't matter if you've tested, we ask you if you've tested. And now we have broadened this CARE registry is what we call it, COVID Active Research Experience. We've broadened it also to include people who've been vaccinated, whether or not they have symptoms from COVID. So we're studying what's your vaccine experience? We're unique because we have all these comparators, internal comparators, if I can talk my epidemiology speak. So community reporters, we can, based on you telling me what symptoms you're experiencing, how severe they are, and me asking you these questions every week or two over a long period, I can start to understand how long COVID lasts, who's really at high risk. Not just looking at hospital cases, looking in the community, who can't get out of bed, who can't care for themselves and their family, and what are those characteristics? So we really understand which of us could leave the house, which of us, maybe will benefit most from either from vaccination or from early treatment from COVID if we're likely to get into a long, bad spell.
I have a question just to jump in. Are you working with, I know the NIH just, they got $1.15 billion of funding to study long COVID. And part of their mandate with this funding was to establish a patient registry that specifically looked at hospitalized and non-hospitalized patients over time throughout the country, throughout the United States. Are you working with any of the other existing, I'm also part of a patient registry at Mount Sinai in New York, which is looking at everyone who, Mount Sinai has a bunch of hospitals. They bought a bunch of hospitals. They're a pretty large organization. And they're including in their registry anyone who saw any doctor in the Mount Sinai system for anything COVID related. So again, not just hospitalized patients. So are you working with other existing efforts at registering patients, or how does that work?
Well, so we started just as if you can consider that a big company could have a grassroots effort, this is what it was, totally self-funded. We called our friends and family and neighbors and and everything we could to raise awareness. NIH funding for, as you just talked about, is just coming out, and we have applied and put in partnerships. They're doing wonderful things at Mount Sinai. A lot of hospitals are. We're seeing some really unique pockets of unusual data collection, like I think it may be Mount Sinai that has a genomic study. These are important. Our biggest focus on what makes you feel better faster. And we're unusual because we not only study your medical history, your prescription meds, but we're also asking people about non-prescription meds and minerals and vitamins and supplements. And I think this is going to help us break some of the myths. You know, everyone, you turn to your friend or neighbor and they say, oh, I took vitamin D and I'm fine. It's not that simple. You can't go from case reports reliably. What you need is population data. So yes, Adina, we've put in for funding along with, unfortunately, many people. And so hopefully some will come our way, but the partnerships are extremely important.
So what's the actual, what are you asking people with long COVID to do, and what's involved in terms of the time commitment and over what period?
So our study goes up to a year, and we are having to roll that out in various countries. We just rolled that out in the United States. What we ask you to do when you enroll is tell us when your symptoms started, and then tell us what they are now and a little bit about your medical history. Then for the first month, we'll send you a reminder once a week. And then after that, we'll follow you up every 2 weeks for a year, or invite you to have that follow-up. We also ask if you can give us an alternate contact in case we lose touch with you. And this is an important feature because some people get quite sick and aren't able to respond. And by giving us, it's optional, but giving us contact of a best friend or next of kin, we can contact somebody to find out if you're just sick and tired of responding to surveys, or in fact, you're quite ill. And both of those happen.
And in terms of, so it's every fortnight, every 2 weeks. So how long does it take me if I'm doing this every 2 weeks? Is there a way of kind of saving my symptoms that I've entered in the past, or do I have to re-enter stuff every time?
Well, we ask you your symptoms and severity every time. We're constantly working on improving the tool, Claire, because you're right. I'd like to have it pop up. Last week, you said you were bothered by this, and this. Are you? We're trying to streamline that. But the other thing we're trying to do was response to a suggestion you made on a previous conversation, Claire, about how tiring it is to tell your medical care provider everything that's happened to you. Mm-hmm. So in an upcoming iteration, we're planning to allow you to print a chronological history of what you've reported. So you can just bring that piece of paper to your provider and look and say, look, in the past 6 months, severe. This is not bothersome, that is. So that we're trying to do things like that can help you manage your condition and understand, get a good picture of maybe I feel terrible today, but actually looking back, this is 1 day out of the last 4 months and it wasn't so bad. So.
Oh, that's really good to hear. Thank you for that.
Yeah, it's great to give patients the ability to even just like download their data to a spreadsheet or something, because I know people have all kinds of different systems. Printing out is a great start, but also just in terms of patients having control over their own data, access to their own data, I know that it's in the back end somewhere in a spreadsheet. So if there's a way for patients to access it, or a spreadsheet-like document.
Yes, and that's also where I can't promise on the format yet, Adina, but I heard you. And we hear you, and that feedback is what is driving us helps drive us to make it better.
Yeah, that's really great to hear, because I think a lot of us, as Adina said, are trying our own ways of tracking stuff. And also it's incredibly exhausting to have to explain if you've had 30 or 50 symptoms and they evolve over time, and that takes up most of your appointment, even explaining what they are. And sometimes medical professional either doesn't have time or actually doesn't have the inclination to listen to everything. So to be able to be armed with a download, or you can email in advance or give a piece of paper, that's something that's actually useful for the patient. We're not just giving our data for the purposes of research, which in itself is great, but to actually have a benefit ourselves, I think, is more likely for people to stick at it.
I fully agree, and we're working. It's surprisingly challenging to do that. So Adina, your point about putting in a spreadsheet, I get, because I'm a spreadsheet user and I totally understand. But making it in a format that's useful, I'm sure it'll start in a clunky format, because most do. But the visual display of information is really powerful. So we're starting that, just trying to work on getting some publications out of what we've learned so far from CARE. So there, and we try to post those on our website. So for people who want to read a science article, they can, but just trying to show the burden and illustrate things in a way that anybody can look at it and go, wow.
I think that's really interesting, because that's something, again, it's a way of giving back to the patient community. How is my data being used? So if there were periodic webinars, because I think, frankly, people with long COVID, especially if they don't have a scientific background, will struggle to read scientific papers if we have cognitive issues and all that kind of thing. But just maybe if there are periodic webinars where you're giving some of the highlights, again, it's a way of giving back, and people thinking, well, I'm not just sending this data into the ether. Actually, this is how it's being used, and I'm contributing to learning and to science. So I think that's another way of really keeping engagement.
Yeah, I think I'm one of the few people with long COVID who actually has an easier time reading scientific articles than going to webinars. So I appreciate both, but I agree that most people find webinars easier.
Yeah, as long as they're not too long, obviously.
But it's a fair point, and there are you need to reach people in a variety of ways, and it's not just putting up information someplace. So my offer to you, my standing offer to you, is if and whenever you want an update, a webinar, you just let us know.
Yeah, and I think maybe webinar is the wrong word, but just a small video recording. Here's an update of our learnings. It could just be you recording yourself on your phone or something. It doesn't have to be a huge.
Like I feel like slides are often helpful, like the way, just like a slide of different things you've learned from. That's also good.
Well, you consider this note taken. Okay.
Excellent, thank you. So back to what you said earlier. Did I get it right that even if you don't have to have fallen ill recently to be able to take part? So someone like me who's been ill for more than a year, I can start reporting now, can I? And that's still valuable.
Very valuable.
Okay.
We ask you approximately when the symptoms started, and you give your best guess.
Yeah, and I don't need to be I don't need to be hospitalized or tested positive. I can just put in my self-reported. Yeah, that's great.
People are welcome if you have symptoms, if you've been tested, or if you've been vaccinated.
Yeah, great. Because I think one thing we've touched upon in the past is that a lot of us don't have a positive test because tests weren't available, or even if they were available, obviously there's lots of false negatives, for example, and also people don't necessarily.
People who couldn't get tested until a few weeks after they fell ill.
Yeah, or they have symptoms that don't make them eligible for testing if their symptoms aren't recognised in their country as being official recognized symptoms. So there's so many reasons why, as you say, Adina, the delay in getting tests because of some of those other things, and indeed being too ill to actually leave the house. Here's another one. So I think it's really valuable that you are capturing data, and I think it would be very interesting. We've seen other studies do this, but it might be interesting for you as well to look at the correlation in symptoms and severity between those who have a positive test and those who don't, because I think that can be quite revealing, because I think sometimes some studies we're hearing of, they're using people who don't have a positive test as the control in their experiment, and I think that's potentially really quite flawed in some ways. So I think the self-reporting aspect is actually really important. So
I do too, and one of the things we added in one of our recent updates, which I hope you won't laugh at how slow it took us to get this, but just some simple quality of life questions. Are you able to do your activities of daily living, to care for yourself, to care for your family, and to go to work? Yeah. And I'm so glad we did, because that's just a key indicator of the toll of this condition.
Yeah, it absolutely is, because obviously there's a very big difference between having a mild headache for many months and a severe migraine where you can't lift your head off the pillow and unable to work and function. So I think that's a key measure, isn't it, of a key indicator. Can you do your caring responsibilities and your work? So Adina, I don't know if you had any other questions you wanted to ask.
I've just been jumping in as as things come up.
Yeah, so I think we've covered actually a lot of the questions I have, but I think it would be really helpful perhaps just to finish off by again pointing us to where we can find this tool.
Yeah, I think, well, I guess one other thing just before that is, I guess people might be concerned about data privacy and data security. And so, If there's anything you can say about that, I'm sure it's something you've thought of. It's a huge issue.
I'm very appreciative that you mentioned that. And let me answer that in a two-country answer, because each country and every country we add on this has their own data security, data privacy practices. UK, particularly restrictive. All our data is stored in the highest level security facility that has more bells and whistles than I don't even know the tune, but it's highly protected. In the United States, it's highly protected, but in different ways, and consistent with US privacy protection. And there, the advantage of the fact that we are a large public company, we have a lot to risk if there's ever a data breach. Would harm a huge book of business. So this is very, very serious business for us. We also have something unusual in the United States that we can't do in other countries, where when you consent to participate in care, www.helpstopcovid19.com, we ask if we can link your data, if we have your permission to link your data with any other existing data, if we have it. And you can consent to that. And what that allows us to do is we have a secure tokenization, irreversible process that's been used for decades now, which allows us to link, for example, sometimes we purchase and tokenize pharmacy data. So from pharmacy outlets, so we can help not ask you 55 questions about medications you're taking, but we have some prescriptions to back it up. And in some cases, we also have some medical claims data, so we can find what the doctor thought, or if you had a vaccine and you said it was so bad you needed to have a medical consultation, we can check that. It's only a small proportion of the patients that do match, but it's a powerful augmentation, much like those partnerships we talked about, Adina.
Can patients see what that tokenized, anonymized data is that you're able to link? So they can't.
Privacy rules on the data don't allow anybody else to see it. And we actually have extraordinary privacy protection and some pretty draconian restrictions on who can access it in terms of analysts.
That makes sense. That's good, actually.
Yeah, that's reassuring. Yeah. So I suppose, yeah. So I think what would be helpful as well, just before you maybe wrap up, is I can't remember if you told us, this is my brain fog speaking. Did you tell us at the beginning how many people are currently reporting in the tool to date?
We have about 25,000 people reporting today. It's the hardest part of this project is recruitment and drawing attention to the registry. So this connection with you folks is extremely important, and anything you can do to help us raise awareness in any of the countries where your members are.
We have members in 98 countries. So.
No more than, we've gone over 100 now.
Oh, we have? Oh, yeah. We've gone up, I haven't noticed.
So
they won't be able to participate unless they're in the US or UK today, but we are constantly talking with various countries about rollout. So.
Okay, that's good. So yeah, we have on our website, we actually have a list of support groups in various countries around the world. So if and when you do roll out, then we might be able to,
Perfect.
That might be useful for you. So cool. Do you want to just say the website one more time, Nancy, before we wrap up?
Yes, it helps. Thank you. Please look at helpstopcovid19.com. So there's no hyphen, just helpstopcovid19.com. And I really want to thank you for taking the time to talk to me and helping drive research from this important network that you've created. We want to amplify your voice. And I think that collecting your stories, your information will help that.
Yeah, thank you. And just to, I guess, finally, the first time someone registers, they'll have to enter more data than they would on an ongoing basis. So
yes, thank you for clarifying that. Yep.
Yeah.
First time is a little longer, second time is shorter.
Yeah, great. Thank you very much indeed. It's been great to talk to you.